Good morning, I'm Trisha. I'm not quite 24 hours out from total knee replacement on my left knee, and I'm just making this video hoping that it might help somebody else, because I know I sure searched a lot, and basically when I saw some of them were taking 20 minutes, 30 minutes, that was too long. Didn't need that much all at once, just wanted some little clips, bits and clips at a time. So the first one, I'm going to try to keep it under 5 minutes just to let you know what exactly my experience was yesterday. And then I'm going to try to update every day or two on what's going on after that. So yesterday I did have total left knee replacement. It was not as bad as I thought it would be. The only hard part was when I went back to get the block right before the surgery, getting the needle in my lower back. It was a lot like an epidural for women who have had a baby. It was similar to that, but mine was 10 times worse. It took 2 different doctors and about 40 minutes for that to happen. I think it was supposed to be less than a 10-minute little procedure, but it was not. What it felt like was they went very low on my back, and first I just felt like a little sting, like a little a numbing needle. So that was just the local to get it ready. And then I could feel a little bit more of the second. They said it was supposed to feel like pressure. I was sitting on the edge of the bed, holding my head over, slumped, kind of curved. And I did have a wonderful technician there who was trying to talk me through it. We were talking about what's any place in the world I'd rather be than in that spot at the moment. So that was great that he helped me talk and breathe. But it felt like somebody kind of hit your funny bone and you got a pain that went, sometimes it would go from my lower back all the way down to my toe. Sometimes it only went to my knee. My leg felt a little heavy, but it didn't get numb. And then they would stop that and try again with another local little sting, and then they would try that feeling again. That would shoot down my leg. They said it's not supposed to be painful, it was just supposed to be pressure. It was pain. I'd love to see in the comments if anybody else had the same, or if they just felt the pressure, because I hope you just feel the pressure. When they finally switched doctors from the anesthesiology team, I kind of knew must be something difficult going on back there. Again, same little stings, little mini shots, I would call them, and then shooting pain down my leg here and there. Finally, that just became pressure. I mostly just felt it down my left leg, which I know was the goal. Finally, it did spread and both legs became totally numb, but I could still turn sideways and put my legs back up on my bed, the surgery bed myself. I was completely wide awake. I wish I would have had like something maybe to relax me in my IV, but I didn't. And they put up a big sheet in front of me like you see on TV, so I couldn't see. I did look down there a couple times and they're like, don't look, don't look. I could feel just a heaviness, heavy pain in both legs. Finally, I could no longer move my legs. I kept wiggling my toes to see if I had control or not. And what I felt like, I couldn't tell if I was wiggling anymore, then I felt pretty confident that I wasn't going to feel anything. They did put my leg up, like it just maybe not a 90-degree arch, but maybe a 70-degree angle. I could see that. I could see him cleaning it off. And then still totally wide awake. And that's when I asked. I was told it was going to be like a twilight sleep and that I wouldn't remember any of it, but I would have liked that feeling a little sooner. So finally I asked, and I'm like really wide awake here. Is there supposed to be something going through this IV helping me fall asleep? And they said, oh yeah, we just turned it on really slow, And I'm like, well, could we turn it up a little bit? Because I'm just like getting antsy and anxious. So then they did turn it up a little bit. I know why they did it slowly, because when they turned it up and I got more medicine at that time, it was stinging, 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 stinging. But I was okay with that because I, at that point, just wanted something to be asleep. Next thing I know, I kind of glance over to my doctor, wonderful doctor, Dr. Tapik at OrthoSensi. He was amazing. And I see my foot like way up high. So I'm thinking it's still like at the 80-degree angle, but it was straight up in the air. And I could hear hammering going on, which I've seen in other videos. Didn't like seeing that. Shortly after that, though, I did fall asleep. So that was my experience before the surgery. And I'm going to stop there, because I think I would have liked to have known pre-surgery and then come back for another part for post-surgery. And again, I'm going to try to keep these as short as I can, because that's what I was looking for. So good luck if you're getting ready to go through something like this. And I'll be back in a little bit to let you know about post-surgery.